I would say the biggest obstacle facing the individuals we serve would be connection. There are places to connect. There are services out there to help. But sometimes when you're struggling with anxiety, depression, different things in that nature, it's hard to make that first step to get involved in services. So we try to make it here at MHA as comfortable as possible. We definitely are willing to meet individuals out in the community, go to their home, whatever we can do to make the step to engaging in services that will improve mental health. We want to make that easier. All of them. I would like the general public to stop believing all of them. But being in this line of work, we come across a lot of different false beliefs. But I would say one of the biggest ones that I've experienced since working with the organization would be people have a fear of people that might be experiencing a mental illness. As we all know, there's illnesses of different severity with symptoms and things like that. And I've come across how people have a general fear. They don't know how to approach individuals that might be experiencing negative symptoms from their mental illness. And a lot of those times, those fears kind of perpetuate individual symptoms because, like I said before, they need that connection, and that can ultimately help them. We do so many different things here. So many wonderful things. It's a great community benefit. The drop-in center, which allows individuals, community to come to socialize, which is another big important aspect, with individuals that are experiencing mental illness. And that goes hand in hand with the connection. So we do the drop-in center. We have many wonderful groups, that again promote socialization, promote independence. We have cooking, volunteer opportunities here. We also have advocacy. That's where an individual can work one-on-one with an advocate on any personal goal that they have, a personal wellness goal. So we do anything from helping individuals find employment, improving self-esteem, things of that nature. So we do housing advocacy. We work with people experiencing homelessness, whether that's chronic or they've fallen on a hard time, get into housing and that kind of thing. We help get connected to benefits, things like that. We also have an apartment program where we help individuals experiencing mental illness or substance use disorder to get into stable housing, and then we work with them to obtain their own permanent housing and address those barriers, whether that's employment, maintaining a home, things like that. We have care management services, and that's where they can work, if they're Medicaid eligible, they can work with the care manager on staying connected to the medical system, the mental health system, if that's needed. We also do our Agape project, which we do. We work with individuals that are going through the family court process. It's a very scary process sometimes. It's very intimidating. So our Agape specialists will work hand in hand with the individual by going to court with them. We offer mediation services, so maybe possibly we can avoid getting into the family court system. We help with petitions for custody, visitation, child support. We also help with uncontested divorces. We also have our Vets Peer-to-Peer Outreach Center with veterans, no matter the discharge status, on any personal wellness goals. All of our services are all person-centered. We want to work with the individual, not for the individual, so we work side by side. So I would say I chose to work here because I'm also an individual that's gone through the mental health system. I suffer with anxiety. I identify as a peer. We're staff here at the organization are all certified peers, meaning that we've experienced some kind of trauma in our life, or we've had to deal with the negative consequences of having a mental health disorder. And I like the fact that here we can use that experience to empower and to really work hand in hand with that first-hand experience with individuals from our own perspective. And I firmly believe in all the programs and services that we do here. I know how difficult it is when you're struggling, how, where you might want to reach out. You know that it might be a good idea, but making that initial step shows a lot of strength. So we're here to help you make that initial step. Give us a call. If you can't stop in, we'll meet you at your home, talk to you on the phone, because we definitely want to address any kind of barriers that anybody's facing, to get the needed mental health services. The easiest way individuals can help the people that we serve is understanding how important connection is. It's as simple walking down the street saying hi. It's as simple as that. Just making all individuals feel included in the community.